Joining me on this very special broadcast of India Today is Dr. Christopher J.L. Murray, who he is MD and DPhil Institute Director of Health Metrics and Evaluation and Professor and Chair of the Health Metrics Sciences at the University of Washington. Thank you so much, sir, for joining us, and I thank you for your precious time as well. You have given some predictions and the modeling studies based on which you say that there could be at least 3 billion infections in the next 2 months. That seems to be a big number, but what are your current projections for India that's already looking at a slow emergence of the third wave of coronavirus led by Omicron?
Well, because India had such a terrible Delta wave, that combined with vaccination efforts suggests that there's quite a bit of immunity in India that will provide some protection against Omicron. So what we expect to happen is lots and lots of Omicron infections, reaching a peak in the end of January or first week of February. The number of infections per day may get up as large as the Delta wave back in April and early May. But the big difference is that the Omicron is not going to cause the death and hospitalization that we saw before. And so the other thing about Omicron that's very different is a much larger fraction of people have no symptoms at all. So they may never get detected. So the official case data may not increase in India anywhere near what we saw with the Delta wave.
So, Doctor, essentially what you're saying is we could probably see the similar number of cases we saw in the second wave. India peaked at about 4 lakh cases during the Delta wave, but these were very severe infections as well. And you're saying that Omicron is not going to cause increase in hospitalizations and death, despite the fact that case numbers will be large?
Well, I think it's very important for people to recognize the difference between infection and an official case. With Delta, many of the infections got eventually detected and became a case in the official numbers. But with Omicron, with 90% of people having no symptoms at all, most of those people will never become an official case. And so there's going to be this very big distinction between true infections in the community and the number of cases that you pick up. And then even amongst the cases that get diagnosed, that get tested and get recorded, we know with Omicron that a smaller fraction will go to hospital than for Delta. And amongst those that go to hospital, a smaller fraction will end up needing the ICU or intubation. So putting all that together, we expect some increase in cases, some increase in hospitalizations and deaths, but dramatically less of a threat for India than the Delta wave.
Well, your projections and studies also says that the peak transmission should be happening somewhere in mid of January with over 35 million global infections in a day. That's nearly 3 times the Delta wave peak that happened in April. Well, we are also looking at a steady rise in hospitalizations. So when you look at hospitalizations in the US, doctors and medical experts have been talking about how pediatric age groups have started to become hospitalized. And that number seems to be going up. What's the reason? Because in India, we still haven't seen as many pediatric cases, or is it too early to even predict the data of hospitalizations here?
So we have this huge number of infections. So Omicron will infect as many people in this 2-month period as have been previously infected in the world through the whole pandemic. It is much less severe, 95% less severe. But you put those really big numbers times, even though it's much less severe, you're still going to see the increase in hospitalization and to some extent increase in death, but small, that we're seeing in the UK, in Denmark, in the United States. It will happen because of just the big numbers of people. Some will end up needing hospitalization. In India, we expect the peak to be a bit later, perhaps in the first week of February. And what the reason you're not seeing a big increase yet is that it's early days. But nevertheless, it should not be the terrible, circumstances that you saw with the Delta wave.
Well, you also said that detecting infections at the global level will reach 3 times the previous peak. And especially in the US, the peak will be somewhere about 400,000 a day. And it has already crossed that figure somewhere. How does it impact countries where there already has been a devastating Delta wave and people are largely vaccinated as well?
Well, the key thing about vaccination, which is why it is going to reduce the harm from any wave of COVID, is that vaccination provides a lot of protection, particularly in the first few months after vaccination, against severe disease and death. What we're learning from the United Kingdom is that vaccination does not provide that much protection against infection with Omicron. So we will see many vaccinated individuals getting infected with Omicron, but not having severe disease and death. So we should not be surprised when we see a lot of, quote, breakthrough infections in the vaccinated. And then past infection also provides quite considerable immunity against severe disease and death. And this is why India, because it has had vaccination to some extent and had that terrible Delta wave, should avoid a very large increase in hospitalization and death, but there will be some.
And certainly these projections do say that numbers are going to increase. And we saw a devastating Delta wave in India with hospitalization infrastructure crumbling. And that is something that we don't want should happen again. But Dr. Murray, there are some estimates being made by experts that say that infection with Omicron could actually help quell the pandemic, as we say, because Omicron is a milder version of the Delta variant. How much do you assess these kind of comments?
For those countries that were currently going through in the Northern Hemisphere a winter Delta wave, it is quite possible that Omicron will actually lead to less hospitalization and death than would have happened with the winter Delta wave. We did not see any prospect of a, quote, winter Delta wave in India because you'd had such a large previous Delta epidemic. So in your case, in the case of India, Omicron is not going to reduce things because you weren't going to have a third wave yet, or so we believe. But it will nevertheless be a mild one in terms of hospitalization and death.
Well, certainly the experts here are falling short of saying that the wave is mild because people are becoming complacent and are not masking up. In your studies, how much contribution would masking or complete masking, wearing N95 masks, give as per projection studies as well to countries from trying to reduce cases? How much can masking help in this?
Well, one of the things we've learned throughout the pandemic is that masking really works, particularly when people use high quality KN95 masks. We know this from studies of healthcare workers where they have proper equipment have no higher rates of COVID than anybody else in the population. So we have absolutely clear evidence that masking works. So those individuals who are at risk, they're older, they have some other comorbidity, would be very wise in India to mask because it's the most effective strategy in the short run to protect yourself because it works as soon as you start masking. The other strategy, of course, is to get vaccinated if you can get access to a vaccine, and if you completed your vaccination less than 4 months or more in the past, then if it's possible, we now know that getting a third dose also helps on protection. So those are the main effective strategies right now available to individuals.
What are policy interventions that countries such as India need to take at the moment? Because we are looking at governments not wanting to impose lockdowns like it was being done initially across the Europe as well. India is shying away from imposing a full lockdown, and lesser restrictions than earlier are being imposed at this moment. What do you think could be major policy interventions that government could take at the moment?
Given all the evidence we've seen to date, major lockdowns do not seem warranted, given the greatly reduced severity of Omicron, and given how much more transmissible Omicron is. It's going to infect so many people, it will be very hard to stop the transmission. So I think the focus for policy goes from controlling infection to making sure that death and hospitalization stay as low as possible, and avoiding the disruption to schools and to the economy that can come from people testing positive and having to quarantine at home. So right now we're in this transition from thinking that we're going to stop transmission to thinking about minimizing death and hospitalization and reducing disruption. Now, having said that, the main strategies available right now for governments are promoting what works for individuals, which is vaccination to reduce, that small fraction of people who will get hospitalized and could die, as well as promoting high quality mask use. Those are the main strategies right now, given just how transmissible Omicron is and just how much less severe it is than the previous wave.
Another question I'd like to ask you, because countries are not just experiencing Omicron, there's a mix of Delta and Omicron. People in Israel are speaking about Florona, a flu with the Omicron or Corona. And there's another mutation that's recently being reported from France called IHU. So unless these mutations continue, can modeling studies be modified and changed to check whether these could have an impact on the pandemic, or as we say, the third wave?
So the key thing one of the key things we've learned through the pandemic has been how new variants have emerged. The Alpha wave, then the Delta wave, and now the Omicron wave. We've had other variants in between, but they had much less of a global impact. And the key, it's almost impossible to know where the next variant is going to come. But having said that, what we know about variants, especially as the world gets more and more vaccinated and more people have been previously infected, so there's some degree of immunity in the population, that for new variants to be successful, they need to be more transmissible than the current variant and or able to evade the immunity that individuals have. So what we call immune escape. Right. So the combination of transmissibility and immune escape is what will determine whether any new variant that comes along is going to make a difference. The variant in France so far has been around for quite some time and hasn't really spread very far. So far, no indication that it's going to be a major problem. But of course, we don't know because it's only recently been characterized for sure. Will new variants come in the future? Very likely, given everything that we've seen around coronavirus. And the real question for the future will be, will it be something like Omicron, mild, and we will just not need to really act or intervene? Or will there be new variants that come along that are transmissible, but unfortunately go back to being more severe? And we don't know when that might occur. And the best strategy for government and for individuals is the same things that we currently know, which is get vaccination as high as possible, where appropriate, use a third dose, and be ready if there is a new wave to use masks and other interventions if that new wave ends up being a severe form of COVID.
Well, India is still not vaccinated children below the age of 15. We're only vaccinating teenagers. And it is the younger population that seems to be getting infected more this time with Omicron, although there is some hope that the infection remains mild, but we still don't have any data on long COVID and how much that will impact the human body in the long run. So would you say that policy interventions on children's vaccinations should also be speeded up?
Well, I think so far there's compelling evidence that some of the vaccines are safe and effective in children between 5 and 15. And wherever possible, if countries can afford that, that would be a good strategy to reduce this risk of long COVID. The risk, as we know, of COVID for severe hospitalization and death is very low for children. Unvaccinated children, which has been one of the facts that we've seen throughout the pandemic. Age is the biggest predictor of severity by far. So, but still, there's some risk, and everybody wants to keep risk to an extremely low level for children. And so, where possible, vaccination for children makes a lot of sense.
Well, thank you for giving us that hopeful ray at the end of it, because we are hoping that somehow the Omicron virus is the last mutation that we see. But as Dr. Murray just said, there could be more mutations and we don't know. Thank you so much for joining us.
Happy to.
Thank you. Thank you, sir. Please take care. Namaste.
All right. Thanks. Cheers. Bye-bye.